Hi, my name is Dr. Alexi Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face the Facts, we're going to be talking about this term, board certification. You've probably seen this on some websites, on some doctor profiles, but the question is, what does that even mean, and should I care about this? So board certification is a special type of certification that means that physicians have undergone an intense amount of training and vetting that they are now certified by a board of other doctors to perform certain kinds of procedures or certain kinds of medicine. For a lot of the surgical subspecialties, the way it works is that we usually have to do some degree of our medical school, which is 4 years, residency, which is going to be at least 4 years, maybe even a fellowship on top of that, and then somewhere in that process, we can apply for our board certification. That is usually a multi-stepped approach where you usually have some kind of written exam. So it's us taking, tests on a paper, just like you would in school. Then you usually also have some kind of oral exam, which is when you come in and meet face-to-face with these examiners who are other board certified physicians in your specialty. And they will ask you different questions, clinical scenarios, things like that to test your knowledge. And then finally, especially in the surgery subspecialties, there's usually some degree of us showing how many surgeries we have done in this kind of specific field in order to prove that we are competent enough that we should get board certification. In addition to all of this, sometimes some places will require you to get letters of recommendations from other board certified physicians. So you can tell that basically there's this very comprehensive application package that we have to submit to our respective boards. And then these boards of other doctors will review our applications and determine whether we meet the criteria for them to include us into their specialty of board ranked physicians. Now, there are a bunch of different boards out there. You've heard of them, and you can earn multiple board certifications as well. I'm just going to focus on the face since we are face the facts. But basically, if you have someone who is operating on your face, I sincerely hope that they have had some kind of training, as in their residency, in either general surgery, dermatology, ENT or otolaryngology, that's me, plastic surgery, which is Dr. Ruff, Dr. Hannah, and Dr. Patrick, ophthalmology, eyes, or oral and maxillofacial surgery. We're all different specialties where we have some kind of right to be in somewhere in the face. Then on top of that, we have our respective boards that will certify us for these different specialties. So again, you can get American Society of Plastic Surgeons, you can get mine, which is American Academy of Facial, Plastic, and Reconstructive Surgery. There's ASOPers, American Board of Cosmetic Surgery, American Board of Oral Maxillofacial Surgery, American Board of Dermatology with a micrographic surgery certification. So you can see there's a whole bunch of different ones. The most important thing is you want to see that your surgeon has had some kind of vetting process that they have become board certified. You can look this up online by checking all the different boards and entering in their names to see if they are certified. And then you can trust that they have hopefully done enough that they are going to be good, trustworthy surgeons for you to go to. Now, I will put one caveat out there, which is that there are a lot of boards, such as the plastic surgery one, where they actually require you to be out in practice for a couple of years and then submit your practice cases before they will officially reward their board certification. So you may also find a couple of younger surgeons out there where they haven't quite earned their board certification yet, just because they're still in that first couple of year period where they have to earn enough cases to actually apply. But that doesn't mean that they aren't considered board eligible. So that's something else you can ask them for, is are they board eligible? As in, they've gone through most of the steps already and they just have to collect their cases. So in short, that's what board certification means. You can tell on our website, there's a whole bunch of little logos at the bottom of all the different boards that we represent here. And when you are looking for someone to give you advice and maybe operate on your face, I would look for certain representatives who are part of these boards. So in conclusion, go to a board certified physician. My name is Dr. Alexi Wang. I'm a facial plastic surgeon in Washington, D.C. And I'll see you next time on Face the Facts.